Whilst almost every woman in early pregnancy will experience some nausea and occasional vomiting or morning sickness, HG or Hyperemesis gravidarum is something a whole bunch different. For starters, whilst almost 80% of women will get some form of morning sickness, only about 1% will get Hyperemesis gravidarum or HG. HG is characterised by severe, persistent nausea and vomiting. Whilst morning sickness will usually resolve after the first trimester, HG will often go much longer and sometimes will only get better once the baby's been delivered. The nausea and vomiting can get so bad that women can become dehydrated, they can suffer severe nutritional deficiencies, as well as lose significant body weight despite being pregnant. We know that women in their first pregnancy or those with twins are at even greater risk, as well as those with a family history. There's likely a hormonal component also, because we noticed that women with high levels of estrogen and beta-HCG are more likely to suffer. This led to an old misconceived adage that the sicker you were, the stronger the pregnancy. HG also tends to recur. Just ask the Princess of Wales, Kate Middleton, who copped it royally in all 3 of her pregnancies. Her very public struggle helped raise awareness of the condition. Believe it or not, last century, a recognised treatment was strong brandy. These days, we look to aggressive intravenous fluid replacement, antiemetic medications, nutritional supplementation, steroids, and that, of course, which fixes most things, good rest. HG is also linked to some really strange cravings. I guess ultimately everybody is quite different, and many women have found some really interesting and creative ways to control their hyperemesis. I mean, what are some of the weirdest cravings and treatments for hyperemesis that you've heard of? I used to think that I'd heard it all before, but for topics like this, I bet 1 or 2 of you are going to be able to surprise me.